Hey everybody, Miss Lopez here to talk all things skeletal in regard to the axial skeleton. So if you are an anatomy student of mine, please make sure that you get your bone sheet out, and we are going to be going through the entire section of your anatomy list that has to do with the axial skeleton. That's going to include bones, but that's also going to include bony landmarks within the axial skeleton. Okay, so I'm going to try my best to go in order. I apologize if I don't go in order 100% according to your list, but we'll go over all the bones. We're going to start off with the skull and the face, all right? And we're going to start with what are called paired bones. When I say paired, or when we categorize a bone as paired, that means we have two of them, a right and a left. So my expectation is that you can easily say, that's the right versus that's the left. Maxilla or zygomatic or whatever other bone it is that we cover. Some bones in the skull and the face are what are called non-paired bones, where you only have one, like the frontal bone in the front of the skull, for example, and you don't have a right and a left. Okay, so on a bone like that, I wouldn't expect you to say right or left. It would just be the name of the bone. So starting with, in order according to the sheet that's in front of you, we're going to start with the skull and the face. So starting off with paired bones, we have a bone called the maxilla. And the maxilla is the bone that makes up the entire upper jaw, but it also comes all the way up to the top crease of the eye and down toward the cheek. So we have a right and a left maxilla. And if I come a little closer, hopefully you can see that there are some divisions here. If you see and pay attention to, there are lines in the skull that show you where they are separated. So when you were developing in the womb, these bones all kind of were developing separately, and then they developed amongst their space, and then eventually end up fusing, making your face and your skull. Okay, all right, so again, that's the maxilla here. And then we have the zygomatic bones. We have a right and a left zygomatic bone. That is just the name for our cheekbone. So right here is the right zygomatic. Right here is the left zygomatic. Okay, another paired bone further back would be one of the bones of the skull called the temporal bone. So I'm sure you've heard of the term temple before. So like the temple being this like softer region right here. You can also feel your pulse at your temporal artery right there. The temporal bone is the bone that's really right there by the temple. And it comes all the way along and goes down along this lump called the mastoid process, and then up to meet the zygomatic bone making your cheek. So that's the temporal. We have a right and we have a left temporal bone. Now the temporal bone is the first one on your anatomy sheet that is not just the bone listed, but also you'll notice that I am asking that you know some bony landmarks. So there is what's called the mastoid process. And the mastoid process is this bump right here. If you actually feel right behind your earlobe and you point right there, kind of poke into your skin a little bit, palpate right there, you can feel that rough bony prominence that is the mastoid process. We're learning that one because a big muscle attaches right there that has the name mastoid in it. So it's way easier if we just learn it now. And then this hole right here, which leads to your internal ear, is called the external auditory meatus. So we break that word down. External meaning the outer part, so it's going to go from outside to inside. Auditory meaning having to do with hearing, and then meatus means a hole in a bone. Okay, so I could ask you, what is this bone? And you would know it is the left temporal bone. But I could also ask you, what process is this, or what bony landmark is this? And you need to know it's the mastoid process. What bony landmark is in there? And you need to know it's the external auditory meatus. All right, the next one on your list is actually right above it, another paired bone. So if we had temporal here, the parietal is here. And if I actually give you a different view of the top of the skull, you can see that the parietal bones come together and they fuse here, making it so that your right and your left are really kind of fused together. And they also fuse with your temporal. So there's a skull suture here fusing them together. Also will fuse with the back and the front bones, which we'll learn here in a second. So the parietal is on top. You have a right and a left of those. Right. Next on the list, we're going to look back at the face, and we're going to talk about the bridge of your nose. So the nose is pretty funny because we actually have a whole lot of just elastic cartilage out here making up the bulk of our nose. Pretty funny. But you've maybe heard that you can break your nose before, because you absolutely can. So you can break your nose, and up here is the nasal bone. That's actually what would break. The cartilage parts, not really, they're pretty bendy, but the nasal bone absolutely could break. So you have a right, let me get my pencil there, right, and a left nasal bone. And then a teeny tiny little bone, oh gosh, it's gonna be hard to show it here. You see where this hole is going on the internal orbit, right there where I'm putting my pencil? There's a very small bone right there that's called the lacrimal bone. And that is where your lacrimal ducts are found, which are your tear ducts. Okay, so you have a right and a left lacrimal bone, just like you have a right and a left eye. Okay, those are pretty small. And then another that you have multiple of are called the conchae. So the nasal conchae. So if you look inside the nose, in there, see those folds that we're looking at? Okay, there are superior and inferior nasal conchae on the right and the left side. Those are those bony folds, right? And then the last of the paired bones to talk about, we actually can't see on this model, but I want to say, I'll get a different model of them in a second, but I will say that they would be located deep in there because these are the bones of your inner ear. And then as a family, these bones are called the ossicles. So the ossicles are bones of your inner ear that allow for the inner ear to work. So let me show you what that looks like. Okay, so if you imagine your ear, okay, has an internal structure that looks like this. This is what we hear with, and we'll learn about what all of these are called later. But this has to be told what vibrations of sound waves are coming in through our ear. So that's going to happen via these little bones called ossicles. So right here, these three bones between this and this structure are called the ossicles. Now, what do they look like? They are very, very teeny tiny little bones. Let's see. See how small those are? So those are the auditory ossicles, and they have names. So we have this one called the malleus, also called the hammer. This one called the incus, which is also called a anvil. And this one called the stapes, which is also called a stirrup. Those are the smallest, teeniest, tiniest bones that you have in your body. And you have 3 on the right, 3 on the left. Okay, so we have covered all of the paired bones of the skull and the face. Now let's talk about the non-paired bones. So if I get my skull back. Okay, we are going to talk about the frontal bone first. So the frontal bone is just the one in front. It's the bone that makes up your forehead. And it's a pretty big bone. It makes up the whole top, really, of your orbit on both sides. And then we can see that it comes all the way back here and fuses with your parietal bones. Okay, so it's a pretty big bone, pretty strong bone too. Okay, another one that we can see from the front is a bone called the mandible. So this bone is the mandible that makes up your lower jaw bone. Okay, that's your lower jaw, the whole bone. It's very irregularly shaped. It's categorized as an irregularly shaped bone. Houses your lower teeth. And then another one that we can see is the occipital bone. So this one is going to make up the occiput, which is the name for the back of your skull. So it goes all the way from underneath here to here, okay? And the occipital bone fuses with the parietal bones there, making them connected. Another bone that we have in the front, I'm going to skip to because we can see this on this model, is what's called the vomer. Okay, the vomer is this little wedge of a bone that your nasal septum, which divides your right and your left nostril, that actually anchors into. So that's the vomer bone, right? Okay, the other 2 bones on your non-paired list, really we can't see unless we take the top of the skull off. So look at this. We're looking at their head. Oh, poor hillbilly. He's lost his tooth. We're looking at the face, and we've actually taken the top of the skull off. So we're actually looking inside. No brain here, obviously. So there are 2 more bones here. What I think is kind of shaped like a butterfly. But your textbook says it's shaped like a wedge, which I get it from the other view. But that is called the sphenoid. Okay, that's the sphenoid bone. And then right in the middle of that, right in the middle of the top portion of your lowermost skull is called the ethmoid bone. So the sphenoid is here making up the rest of the base, and then here is actually the top of your nose. So if you've ever been told that you could pick your nose and scratch your brain, you actually can't do that because there's an ethmoid bone right in the way. Okay. All right, so those are all of, ooh, I missed one. We also have, let's see, we also have a palatine bone. So the only way that we can see the palatine bone is if we look in the top of the mouth. We have a right and a left palatine bone. And that leads to the nasal passages. So look at this. Look at this. These empty holes right here, those are going to your nose, the back of your nose. And then down here would go to your mouth. So the palatine bones are making up the top of your palate. You can run your tongue along your palate. And as your tongue gets further back to the dangly thing in the back of your throat called your uvula, that's the palatine bone. Okay. All right, now we have officially accomplished the entire skull and face. Now let's talk about your torso. So I have a headless, a mannequin or a skeleton behind me. And I wanted him headless because the only way to really see one of the bones is to have him headless. So I'll explain that here in a second. But first, let's talk about the ribs, since those are the paired bones here. So of all of the rest of the axial skeleton, really the only other sets of paired bones are the ribs. And you have 12 pairs of ribs, okay? 12 pairs. That means 12 on the left, 12 on the right. And the way that we name these is by number and by side. So we identify them that way. Let's see. Come here, Ernesto. So we can see that starting underneath the collarbone is number 1. So that is the first rib. And then we have to consider, what side is it? Well, the skeleton is looking at you. So this is the skeleton's left first rib, left second rib, left third rib, left fourth rib, all the way down until we get to the 12th rib, which is kind of tucked underneath here. Okay. And then the same thing is true for their right side. Right first rib, right second rib, and so on and so forth all the way down. So I could ask, or it's important to know, like if one of those ribs is being referenced and the question is, what rib is this? That you say both the side and the number, okay? And then a follow-up question could be, what type of rib is this? Meaning, how do we categorize it? And what we look for when we're categorizing ribs is this stuff called costal cartilage, which is made out of hyaline cartilage. And we've talked about how it's important that your rib cage is relatively bendy so that you can expand and contract it to be able to actually allow for you to breathe, right? So notice that the first 1, 2, 3, 4, 5, 6, 7 ribs have their own costal cartilage coming off of the rib and go all the way and attach to the sternum. So both on the left and on the right side that occurs. So those are called true ribs because they have their own costal cartilage that attaches them to the sternum. And then these guys down here, ribs 8, 9, and 10, both on the left and the right, all have to kind of hijack the 7th rib's costal cartilage in order to get to the sternum. So those are known as false ribs. And then there are 2 little stinkers under here that are hiding that are called floating ribs. And we have 2 of those. Ribs 11 and 12 are called floating, and they do not attach to the sternum at all. Okay, so they're back here, and they only are in the posterior section of our thorax, protecting our kidneys mostly. So those are only in the posterior. Okay, so that's the paired bones. Now we get to the non-paired bones. So this is why I have him headless, because we have a very special bone in our body that is called the hyoid bone. And we can see it up here at the front of Ernesto's neck, okay, in the front of his cervical spine, we call that. That's the hyoid. Now, the hyoid, I say, is very special because it is the only bone in your body that is not directly attached to another bone. So it's actually floating in a mass of muscles, and it's actually hanging out right above your voice box. And that has all of the muscles surrounding it. You're falling. Surrounding it that will allow for you to speak and to swallow. So the hyoid bone's floating right here. On Ernesto, yeah, it's wired onto the cervical spine, but that's not the case in you. It's actually floating right here in this mass of muscles. Okay, so that's the hyoid. And then we have the sternum. So the sternum is this flat bone here that makes up the center of your chest. And the sternum itself has a couple of landmarks that I want you to be aware of. So what's known as the top of the sternum is called the manubrium. And then we have the body of the sternum. And then we have this little hook at the bottom called the xiphoid process. Okay, so all those pieces of the sternum. and that's what the ribs attach to in the front. In the back, the ribs attach to something else, and we'll talk about that here in a second. So that leads us to the spinal column. So I'm gonna flip Ernesto around. So you all have a spine, and the spine is composed of 33 different vertebrae stacked all on top of each other. Anyway, so we have in our spine these individual vertebrae all stacked up. And notice, if you're paying attention to like the size of the vertebrae, these vertebrae up here are pretty teeny tiny. So if I put an individual vertebrae that would be from up there in front of you, it looks like that. So that's a vertebrae that's found in your neck. Now we call the neck your cervical spine. So every single one of the vertebrae stacked up on top of each other within the neck are referred to as a cervical vertebrae, or abbreviated with a letter C. C for cervical. And there are 7 of these. There are 7 cervical vertebrae. And they all look like this. Some of them a little bit bigger, with the exception of the first 2. So the first 2 cervical vertebrae are a little different because they have to hold on to your head and allow for it to rotate. So your first cervical vertebrae, C1, has a very special look to it. So it looks like this. So notice how that one looks different than this one. Okay, just slightly different. The reason is because what has to sit on top of this thing? Your head does. So the skull has to be able to sit on top of the cervical vertebrae. Has to be able to specifically sit on top of C1. So C1 is nicknamed the atlas because it holds on to the head. Okay, so that's the atlas, aka C1, and then right underneath C1 is another very special vertebrae that's not shaped like any other vertebrae that we have, that is called, or nicknamed, the axis. So we have the atlas, and we have the axis. The axis is called that because it has this protrusion called the dens. And the dens allows for, as C1 sits on top of it, it allows for the head to rotate. So look at this, rotate. Allowing for you to look right to left. So C2 is a very unique looking vertebrae, nicknamed the axis. So we have the atlas and the axis. All the rest of the cervical vertebrae look pretty dang similar to this. They increase in size a little bit. So understand that in this class, I'm not going to put an individual vertebrae in front of you and say, what vertebrae is this? Tell me exactly, is it C7? You will have to do that in a more advanced anatomy class if you take it. But I will expect that if I put this one, or if I put this one in front of you, that you know that these are nicknamed the atlas and the axis. On top of that, how I will ask you is I could put the spine in front of you. I could put Ernesto's spine, I could put another model of a spine in front of you, and I could put a random label, boop, on one of the vertebrae. And you need to learn to count. Okay, C1, C2, C3, C4, C5. Ah, she had the sticky on C6, so that you label it as C6. Okay, so that's the cervical spine. We're only up here right now. Now we transition downward. We are now going to be at the thoracic spine. So the thoracic spine, there are 12 of them. So there are 7 cervical, there are 12 thoracic. And it makes sense that there are 12 thoracic because you have 12 pairs of ribs, and every single thoracic vertebrae, guess what, is attached to a pair of ribs. And what I'm expecting is that you're able to see, oh, look at that. That's the first one that the first rib is attached to. That has to be T1. And then you can count down T1, T2, T3, T4, T5, T6, T7, all the way down to T12. Okay. Looking at the ribs is helpful, or just counting down. So going C1, C2, all the way to 7, and then starting with T1, T2, all the way to T12. That's fine. All right, next we get to the lower part of the spine where we don't have ribs attached. And before we get to the pelvis is the low back, aka the lumbar spine. So this is made out of just 5 really thick vertebrae. Look at this. They thick vertebrae. Look at this one compared to the little cervical one. Okay. Very different. Okay. That's because most of the body's weight is going to be borne through your lumbar spine, so it has to be thick. Okay. And there are 5 of these, and they're abbreviated with an L for lumbar, and then 1, 2, 3, 4, 5. Starting at the upper part, L1, L2, L3, L4, L5. Okay. And then we get to the base. Let's see, can I turn you a little bit? Sure. The base of your spine is made out of the sacrum and then the coccyx. So the sacrum is actually 5 vertebrae that were fused together when you were very, 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 very young. And then we have 4 teeny tiny little vertebrae that fuse together, making your coccyx. Okay, so sacrum and coccyx. I will not have you identify S1, S2, and so on. Just know it is sacrum and coccyx. All right. The last thing to know on that anatomy sheet is if we look at one vertebrae, what anatomy is there in the vertebrae? So while I'm not going to expect you to tell me that this is L3 or L5 or whatever it is, I'm going to expect you to be able to label and identify parts of the vertebrae, whether I give you this vertebrae or whether I give you this vertebrae or this vertebrae. Notice that they have some things in common. Okay, so first of all, this rounded portion, I feel like you can't see me, this rounded portion is called the vertebral body. That's where the weight sits, all right? And then the hole through the middle is the vertebral foramen. And then, if we look here, these guys on either side are called transverse processes. So there's one on the right and one on the left. This one is called a spinous process. So the spinous process is actually what you can feel. It's these bumps. If you were to run your hand along your spine, you would feel the spinous processes. Okay. So again, we have the body, transverse processes, spinous processes, and then you have the lamina, which connect the spinous process to the transverse process, and then you have the pedicle, which connect the transverse process to the vertebral body. And then the last thing on that list, we have the intervertebral discs. Oh yeah, you can see them. So notice that in between every single one of these vertebral body is this chunk of cartilage right here. It's actually fibrocartilage, and those are called the intervertebral discs. Okay? All right, that's the axial skeleton.